Dentistry, transforming your health for a lifetime.
Good morning. This is Complete Health with Dr. Mike Rogers from Complete Health Dentistry of Northeast Pennsylvania. I'm Adam Owens, and joining me in this studio is the winner of the Complete Health Transformation, the Complete Health Butterfly, Christine Lewis. Good morning, Christine.
Good morning, Adam.
You are the proud winner of this amazing whole body transformation, and now you've been at it for a little while, right?
Yes, about 2.5 weeks.
And how's it been going overall?
Amazing.
Yeah?
Absolutely amazing.
So we're going to talk a lot today about your experience at the office at Complete Health Dentistry with Dr. Rogers, but I just wanted to kind of check in on all the other different things that have been going on as part of this process. So what have you been up to? Can you give us a little peek?
Well, of course, I've been going to the gym, down to Cole's gym with a really good trainer, Cindy Anger. She gave me a good cardio routine and good strength training. So we're working on that a little bit more each day. Find out just how weak you actually are. Went down to Lynn's Healing Zone, had my microscopy done.
Microscopy,
yes, that's
yep.
what it is. Told me what I was lacking, what I needed to do, how I needed to change my diet to make me feel better.
Okay.
I also went to Apple Day Spa for a facial so they could kind of see what's going on.
Nice.
Really nice. Never had one before.
I gotta say, you look radiant is a good word. You look great.
And they have the infrared sauna. I'm using that as much as possible.
The infrared, what is that?
It's a sauna that doesn't use normal heat and steam. It's infrared heat, which is better for you.
Very cool.
And more deep into the muscles, and it makes you feel really good afterwards.
And I bet the last couple of sort of colder weeks that we had here, you
it was really
good,
nice.
Right?
You warm up really quick.
Right. Cool. And what else?
And Dr. Chip Whitney, who is the doctor that's overseeing this, we got back my blood work on that.
Okay.
He told me what I was lacking in my diet. We did find some different things that were going on with myself, things that I can try and treat and take care of so my future health is even better.
Wow. The word complete health comes up a lot around here now, and they're really walking the walk and talking the talk.
Oh, most definitely.
Now, I understand you lost a little bit of weight.
12 pounds.
Wow.
So I'm feeling a little bit better.
Yeah.
The joints are feeling better, but still got a ways to go.
Sure. Keep up the great work, Christine. So let's talk a little bit about, now you've been at the office at Complete Health Dentistry of Northeast PA. How did that go? How did that experience go?
Really good. Really, really good.
Okay. Are there things that got brought up that you didn't realize were a concern that suddenly you've got to focus on?
Some of it I kind of knew.
Okay.
I did have a fear of dentistry before. I don't now, thank goodness. Their staff is absolutely amazing up there. They put me at ease.
Good. How long was it that you had been away from the dentist's office?
From actual dental work, probably 5 to 6 years, and a cleaning a little bit longer.
Okay. And was there a reason that you kind of kept away, or
just scared to death?
Really?
Pretty much, yeah. That was it. And people do have a fear of the dentist, and they really should not have it.
So what did they do at Complete Health Dentistry to kind of set you at ease?
Well, just kind of talked me through it, let me know what was going on. They have some really great scented oils that they put on for you to relax you there.
Did you get like the heated neck pillow?
And the heated neck pillow, which is amazing.
Decadent, right?
Oh yeah,
it really puts you right at ease.
It does relax you.
It does. The little things all kind of add up. So what was it that Dr. Rogers determined that you needed after you kind of spent some time in the chair?
Well, just to kind of start, I knew I had some cavities and I needed a root canal done, which we had some cavities taken care of. The root canal's done. My tooth was infected. It feels amazing now. It's no longer.
Root canals, like everyone's terrified of a root canal. Was it that bad?
It's not that bad. Everyone thinks, because the needles and the gums is kind of a hard thing, but they have great topicals that they numb it, so it doesn't hurt like it used to when you were a kid.
Okay, so the sort of the numbing technology has come a lot further.
The numbing technology is amazing.
And it sounds like that combined with the sort of relaxing that you were able to do as you kind of got settled in, it just put you in a better place, right?
Much, much better place.
Okay, so now after this has all been done, so remind me again, so root canal, cleaning.
Oh, I had a cleaning by Tanya.
Okay.
She's amazing.
Yeah.
That's my worst part. I don't like the scraping. I don't like the pain that usually goes with that.
Right.
Nothing.
Really?
It was really good.
And you got some cavities filled too, right?
Yes, I did. 3 cavities.
So do you notice like a change in your mouth now? After
oh my God,
that?
it feels amazing. It's cleaner. Even my teeth even now are even whiter without even having any whitening done to them.
Just the cleaning getting done to them kind of brought them up a few shades.
Yep. And your taste changes too. My taste, I've noticed, has really improved.
Really?
Yes.
Very, very cool. So, and I mean, I kind of, I don't want to, you seem a little more confident in yourself than you were when you first walked in here, when you had first started this process. Do you feel that way?
Oh, most definitely. Because I wasn't sure what I was kind of getting into. And now I'm glad that I'm doing it. And it it's just a great program.
Now, the cleaning that you kind of went through, it removes kind of a lot of gunk that you might not have even thought was gunk. You might have thought it was just part of your teeth, right?
Right. You don't even realize it. You can't see behind your teeth either. When they took pictures and they showed me, I was like kind of floored by what was back there.
Good thing you were sitting down in the chair.
But, they have this great, it's like a water cleaner.
Okay.
That they do on your teeth, so it's not like just constant picking at it. And then they give you this really great HydroFloss for self-care at home, so you can keep it up.
So HydroFloss, explain this. What is this?
HydroFloss is like this little machine it's like a water pick.
Okay.
Now mine right now has some medication. It's kind of like medicated Listerine kind of stuff in it.
Yep.
And it helps me keep up with what they're doing, so it helps it along.
So how are you finding the sort of homework, we'll call it, quote unquote? How is it tough to keep up with, or does it become part of your routine?
Oh, on the dental part, it's just routine. You just know at night you're going to go, you're going to do this, you're going to floss, which I do anyway, and then in the morning you get up, you gargle, you floss really good. It's a routine.
We're talking with Christine Lewis here on Complete Health. Christine won the Complete Health Transformation. She's the new butterfly. Christine, you're doing great. You said you've been at this now. It's only been a couple of weeks so far, but you've already lost weight. Your teeth are back into shape. You're feeling good. And are you gung-ho to keep going with this?
Oh, definitely.
Good. I'm glad to hear that. But I'm sure you've encountered some challenges at this point.
The biggest challenge, getting back to the routine of the gym, of course, is hard for anybody. But right now I'm back into it. And if I miss a day, I feel so weird not going, because you really do I look forward to going. It's kind of a stress reliever.
So you've built the habit then, I think.
Right. And it takes, you get 2 weeks in. After 2 weeks, it's habit. After 4 weeks, you see results normally. And that's my goal. So I'm kind of seeing the results now.
Yeah, it feels good to see the results.
But the hardest part is now I do deliver flowers during the day. So that's not too bad, but I cook at night, and being around all that food that I know is not a healthy choice for me has been the hardest. When you see the girls are eating chips and then I'm making burgers and all these greasy things, I have to try. It's like I'm sitting there and drinking my water, just drinking my water.
Good. Keep drinking the water. What other kind of positive changes have you noticed in yourself? Attitude? Are you sleeping better?
Attitude. I'm sleeping. I'm a mild sleeper anyway. Okay. So, but I just feel better. My joints don't hurt as much. I can bend over and get up without grunting and groaning as much. I just feel better overall.
Christine, congratulations on winning the contest. Way to go. It sounds like you're all the way in on this and you're just plowing forward. So keep up the good work.
Great, thank you.
Dr. Rogers joins us in the studio now. And this year, Mike celebrated his 25th year practicing dentistry in Honesdale. So, Mike, as I understand it, 25 years ago, you came to Honesdale and took over an existing dental practice.
Yes.
And since then, I have not been here the whole 25 years, but I understand it has grown by leaps and bounds.
Yes, it has. It's a testament to my team as a whole, because patients keep coming back. I believe they love and trust us.
And I've seen the practice myself. I've spent some time in there. It's warm, it's welcoming, it's inviting, it's very well decked. Your staff is really friendly. You've clearly done a great job. Sort of lining everything up, pulling everything together, and making a great practice for really all the dental services people need. And when we say complete health dentistry, we're going to talk a little bit later on about what you really mean by that. But I got just a taste of it the other day. I came in for a consultation, and it's a real tip to tail. It's the whole body. Is that right?
Yeah, it is. The mouth is the gateway to the rest of the body. I use an example, and I've talked to veterinarians before. But if you bring your pet to a veterinarian, the first place they look is right in the mouth. They're looking for inflammation, disease, things like that they can see, because their patients can't talk to them. But yet that's a window to the rest of the body. What we do is the same thing. We look at the mouth, and then we address dental problems in a fashion that we believe will help the rest of your body.
We've got folks who are patients of yours who are just brand new for the first time, but you've had folks who've been coming back to you for years and years now?
Yes, we've had patients that have stayed with us for 25 years.
And maybe their kids are coming in to see you now.
Yeah.
This is Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Joining me in the studio is Dr. Mike Rogers himself, celebrating 25 years in the Honesdale area. But as we've learned in dentistry for several years beyond that, it's Complete Health with Dr. Mike Rogers from Complete Health Dentistry. When we come back, we'll find out more about what it means to be a complete health dental practice. Stay tuned.
Complete Health Dentistry, transforming your health for a lifetime.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers at Complete Health Dentistry of Northeastern Pennsylvania. We believe your mouth is the gateway to overall health. Complete Dental Health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Dentistry, transforming your health for a lifetime.
You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Dr. Mike Rogers joins me in the studio. Good morning.
Good morning, Adam.
We're here to talk about what you mean when you say that Complete Health Dentistry is a complete health dental practice. What do you mean by that?
As we talked about a little bit before, I believe the mouth is the gateway to the rest of the body and the health of the rest of the body. It's the first thing that enters into an area, so it's the first thing that gets hit with bacteria, smells, odors, outside pollen, and everything else. So everything we hit usually comes first right into our face.
And then how does that? So you really feel, and I'm inclined to agree with you here. It really connects to the rest of the body. And you used a great example earlier. You said when someone brings their pet into the veterinarian, and the pet can't communicate with the vet. They can't talk. Or they can't say my such and such hurts. But the vet will go almost 10 times out of 10 straight to the mouth first to take a look at what's going on. And do human beings much the same? Yes,
we are. We're just a little bit different because we have opinions. And also we've got years of history on how things have been done, not just what's dictated by history or dictated by an insurance company, but what you specifically need.
Rather than one size fits all, it's more of a case by case.
It is. And I believe most dental practices practice that way, but still a lot of them are still caught in that insurance model.
So let's talk about some of the ways in which dental health affects whole body health. What are some other what are some other ways that the health of your mouth can affect the overall health of your body?
Well, it's amazing that the more you delve into this, and you can certainly look it up online, just Google, say, oral bacteria of the mouth, and any health disease that you want. You'll find unbelievable amount of literature now showing the direct relationship from bacteria in our mouth causing heart attacks, bacteria in our mouth causing strokes, Alzheimer's, cancer, digestive issues, and even breathing issues.
So if the bacteria in the mouth can affect the whole body so deeply, what can be done to control, to mitigate, to reverse the impact of the bacteria in the mouth?
Well, and that's a great question, Adam. What it is first you need to know, is your body susceptible to it? Do you have the bacteria that are creating the problem? And if you don't have that bacteria, then there's no need to go down that path and do something. So what we do first is we actually test for the bacteria, the specific bacteria. We look on slides in our office. We use a microscope to get a good feel. Is there things that we need to delve further into? And then once we go from there, we actually send samples out to a lab to be tested to find out the bacteria.
So this strikes me as something that, I don't know. I've been going to the dentist since I was a kid. I've never seen my dentist look at anything under a microscope. Is this something kind of special to your practice?
Well, you know what? I brought it out. I've had the microscope in my office since I bought the practice. I just never used it because it wasn't commonplace. But what it is when I try and express to a patient my knowledge of what's going on in their mouth, there's no way to understand the amount of bacteria we have. And so for a patient to see it, I decided to bring the microscope out of mothballs, so to speak, and use it as an educational tool and to open a dialogue. Because that's the whole point here, is I want to communicate with my patients in a way that they can get their thought process to me and I can express to them my concerns with their overall health.
And they can, you can kind of be on the same page, and it's not as if you're speaking a foreign language to them. If they can look at the screen and they can see these bacteria with their eyes, and you can say, look, this is what this is, it becomes suddenly everything makes a lot of very clear sense. I'd actually love to kind of take a step back here and have you talk about the process that a new patient would go through as they come into your office for the first time and get to know you and your staff. Because I had the chance to do this the other day, and I thought it was really valuable. I'd love if you would just kind of go through the process that a new patient goes through.
Well, in our office, a new patient, we call it a new patient interview. And what it is the patient comes in, and one of my team members will sit with the patient and actually have a long discussion with their past dental history, their medical, to review a complete medical history with the patient, and answer any questions that they are able to answer on what we do and what the patient can expect in that appointment. From there, we take a tour of the office. The patient gets to see all the nooks and crannies of the office if they choose to, from sterilization to what we're doing in the treatment rooms. And then once we have that, we go into full diagnostics, meaning we take x-rays and photos so that you can sit and see everything I do and not just look at a little bitty x-ray being held in front of you.
So actually like beyond x-ray, regular photographs as well.
Correct.
And tell me about the X-ray. It makes perfect sense to me. Like you can see kind of inside the bone. Now, what are you looking at in just a regular photograph?
Well, in a regular photograph, there's so many things that can be seen. One, we can see, are your gums swollen or puffy? And for most people, since gum disease and gum problems don't hurt until it's too far gone, it's enlightening for a lot of people to actually be able to see full scope of what their mouth looks like from a dental perspective or from standing outside and looking in, as opposed to just when you open your mouth with your toothbrush. The other thing it does is it lets you see things that we see, failing fillings that are breaking down, that are leaking and maybe not causing pain right now. But the whole premise here is to be what we call minimally invasive, meaning keep things as small and tiny and conservative as possible so that they don't grow up to be more problematic, like a root canal or an extraction.
Sort of heading off the problems at the pass, so to speak.
Truly being preventive, and I know dentistry as a whole has always strove to be prevention.
Yep.
But what my goal is in our practice is to be prevention in the mouth, preventative in the mouth, to lead our patients to overall general health.
Now, let's just say that somebody comes in, they have the diagnosis, they have the conversation with your staff, they meet you, you have a look and you kind of find maybe something that you're not so happy with, something you'd like to address. What's the next step for the patient?
Well, in our office, it's a conversation that we have. It's one, does what we see here bother you as well as it concerns me? And then if it does, well, then we move on to treat the problem. If it doesn't, it could just be a misunderstanding. One of the big misunderstandings that we come across is, well, isn't everybody supposed to have bacteria in our mouth? Well, yes, there are, but there's bacteria in our mouth that our body can handle and live comfortably having. And then there's bacteria in our mouth that wreak havoc on our gums, our bone, our teeth, and can burrow into our bloodstream and create heart attacks, stroke, diabetes, and cancers.
So preventing these things before they become a serious issue is part of what it means to be a complete health dental practice. You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. I'm Adam Owens. Dr. Mike Rogers joins me in the studio. When we come back, we'll talk about what sets Complete Health Dentistry apart from other dental practices. Stay tuned.
The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete Health Dentistry. Transforming your health for a lifetime.
You're listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry, celebrating 25 years of dentistry in the Honesdale area, 3-time Happy Award winner of the best dentist in Northeast Pennsylvania. Mike joins us in the studio. Good morning, Mike.
Good morning, Adam.
And we are talking about what sets Complete Health Dentistry apart from other dental practices. Now, at your office, there's a lot of things that patients will experience that they may not experience elsewhere. It's a pretty long list, and there's a lot of detail that you and your staff go into. What are some examples?
Some examples, we take a full medical history, and we relate how the mouth relates to that medical history. And if there's things that we see from a dental perspective, since the mouth is related to the rest of the body and can contribute to the health issues of the person. So we really delve into how the mouth can relate to that. The other thing is what we do is we sit with the patient and discuss what we call a healthy mouth baseline. And what that is what is ideal dental health, if nobody's ever discussed what is ideal dental health, and then what we can help you with to get you there. From oral cancer screening to TMJ, jaw joint issues, which can create headaches and facial pain and even numbness in the hands.
So this is not necessarily, the brightness of your smile, but this is actually a whole body health issue that you're addressing. It's simply the hinge of the jaw. Is that right?
Correct.
I've been going to the dentist since I was a kid. I don't think I've ever had my jaw examined by a dentist, but this is just part of the regular practice for you.
It is, along with that, because we do blood pressure screenings on every patient. We screen oral cancer, as I said. We do salivary testing to check the bacteria. What we also do is we screen for sleep. And
what do you mean by that?
What it is sleep apnea or sleep deprivation or oxygen deprivation when you sleep. It creates a whole host of medical problems. And in dentistry, we can create dental appliances if a patient cannot wear a CPAP, because that ultimately is the best way to treat it. If they cannot, or they're CPAP intolerant, they can't or they won't wear it.
So the CPAP, I'm sorry, just for folks who have just heard of this for the first time, the CPAP is the sort of mask that puts sort of positive pressure against your mouth and diaphragm to help you breathe easily at night, right?
It pushes oxygen into your lungs.
But for some people, you're saying that mask is, for one reason or another, they're not able to wear that.
Correct.
So in that instance, you can help?
Yes, we can. We can make a dental appliance that you wear comfortably at night while you sleep. And I made it a part of my life to really screen for sleep, because or airway issues. Airway issues can start usually as a child. And we screen children for airway issues, which could lead to crooked teeth. It could lead to bedwetting. It could lead to all kinds of other health and future medical issues, along with having dental and jaw problems because of growth and development. So we can screen all of this for your kids, evaluate that, move them through interceptive orthodontic treatments, meaning put things in the proper position, open airways. I work with a lot of ENTs, ear, nose, throat doctors, that we're on a good first-term basis, so that if someone's coming from my office and I really believe that there's an airway issue, they're able to get them in and see them and evaluate them. Do they need tonsillectomy or nadoidectomy that can open these airways, along with just changing the position of their bite?
So the mouth, you've been saying, and I'm really understanding what you're meaning now. The mouth is the sort of the first line that encounters the world, and as a result, it can be one of the quickest ways to ascertain whether or not a certain problem exists. You were talking also that you screen, you do blood pressure for your patients when they come in. What's the purpose of that?
Well, blood pressure is multiple fold. One, it helps us decide what type of anesthetic. The general term is Novocaine to use. It also is because a lot of people come to the dental office 2, 3, 4 times a year, and they may see someone in their medical community once a year or once every other year. And so having multiple screenings throughout the year can eliminate a whole host of problems. It can eliminate a cardiac event in the future, or find underlying problems that you may not see if you don't get this checked on a regular basis. Also, another thing that it does is it's an indicator. If your blood pressure is high, it's an indicator for diabetes. And so there too, it's one way that we can help you get back to your physician, because that's what we try and do, is partner with you and your physician so that we keep you as healthy as possible for as long as possible.
It's becoming more and more clear to me that complete health dentistry is not just a clever name. It really is a way of doing business, a way of approaching the whole health of a human being. We're just getting towards the end of the program now, but I wanted to ask you if there's anything else that you wanted us to touch on.
One of the biggest things is in medicine and dentistry is our body can only fight things using its defenses, and that's what we term as inflammation. You get a cut and your area gets inflamed. You get a bruise, that's inflammation. If you're diabetic, that's an inflammatory response to the blood sugars. So what it is that's going on here is, if you've got bacteria, if you've got problems in your mouth, if you've got inflammation in your jaw joint, if you can't breathe properly from sleep apnea or just growth and development issues because you need to be seen by an ENT and address tonsillectomies, or you're breathing through your mouth on a constant basis, that's all creating inflammation. As inflammation builds, our body's defenses break down because it can't fight everything. And so that's where we start to see all these extra problems show up: diabetes, heart disease, cancers, things like that. So if we can catch this and eliminate inflammation at the beginning, and where it's sitting 24 hours a day, just seeping into your bloodstream, and that's in your mouth, the bacteria there. If we can eliminate that, we can get you healthy, keep you and your family healthy, and around for a long time.
And one more question before we close out, and I want to make sure we get some contact information out there for listeners who might wish to set up an appointment to come in for a screening. If somebody is nervous about a trip to the dentist, if somebody has some nerves about being in the dental chair, being worked on, having their mouth examined, what can you say to them to kind of allay those fears?
Well, in our office, we do multiple things to eliminate anxiety and fear. One, we do believe in essential oils. We have them diffusing through the office to help calm and soothe patients' emotions. We can do sedation if patient is that apprehensive to come to a dental office. But the first visit is just, let's sit down, let's get to know each other, let's look at the whole picture. And that's really what it comes down to. Since the mouth is the gateway to the body, we're going to open that gate and look at everything and just be able to go from there and say, okay, maybe this is the reason for an underlying problem that we can't figure out what's going on for.
So let's give out some contact information for folks who are interested in coming up to set up that first meeting with you and your staff.
Well, you can certainly call our office. If this sounds great for you, call my office and talk to one of the people there. 570-253-5000 is the office number. Or you can reach us on the web at Complete Health Dentistry of NEPA.com.
You've been listening to Complete Health with Dr. Mike Rogers from Complete Health Dentistry. Call to set up an appointment, 570-253-5000, or go online to Complete Health Dentistry of NEPA.com. Dr. Rogers, thank you for being in the studio with us today.
Thank you, Adam.
Complete Health Dentistry, transforming your health for a lifetime.
Start down your own path to personal health transformation today. Call Dr. Mike Rogers at Complete Health Dentistry of Northeast PA. 570-253-5000. That's 570-253-5000. Make your appointment today.